Good afternoon, all. We are going to get started in just one moment. Thank you for joining us. For those of you who are just joining, I see numbers ticking up, so I want to give you a moment to join. But again, I want to thank you for being here. We'll get started in just a few moments here as folks are continuing to join. All right. Once again, good afternoon. We're excited to have you here. I want to just invite you to the webinar on Early Educators' Voices. Why and how do we co-design research that translate to systems change? Before we get started today, I just want to go over translation for you all. So let's go to the next slide. Thank you. So today we are offering Spanish interpretation. And so before we start, I'd like to introduce you to B. Torres, who will give you detailed instructions about interpretation. B.
Thank you so much. Good afternoon, everybody. My name is B. My pronouns are she, her, ella, and I'll be your interpreter with the Community Language Cooperative, or the CLC. And I want to thank you, as always, for your commitment to language justice, which means that everyone has the right to speak in the language of their heart. In a moment, we will activate Zoom's interpretation function, and you'll see a globe icon at the bottom of your Zoom screen. You'll click on that icon and select either English or Spanish as the language of your heart. I want to remind folks to please speak at a conversational pace so that I'm able to provide an accurate rendition of your message. I'll repeat this in Spanish and then we can get started. Hola, buenas tardes. Mi nombre es Vitorres, pronombre es ella, y yo seré su intérprete con la CLC o la Community Language Cooperative, y les agradezco como siempre su compromiso con la justicia del lenguaje, lo cual significa que todos tenemos el derecho de hablar en el idioma de nuestro corazón. En un momento activaremos la función de interpretación simultánea en Zoom y aparecerá un globo terráqueo en la parte inferior de su pantalla. Favor de hacer clic en ese icono y elija inglés o español como el idioma de su corazón. Muchísimas gracias. Ya comenzaremos. Thank you very much. We can go ahead and activate interpretation now.
Thank you, B. We appreciate you. So at this time, I have the pleasure of introducing three folks who will be presenting during the webinar. First, we have Dr. Toshiba Adams. Next, Lisa Garley. And last but not least, Ruth Schmidt. I do want to just mention, as folks are going to be sharing, we do want to make this interactive. If possible, feel free to use the chat box as well as the Q&A box. If you have certain questions that you need clarifying or information that you need to be clarified, feel free to use it. We'll be monitoring it and try to answer as many questions as possible. But with this, I want to turn it over to Ruth.
Thanks, Erin. Hopefully some of you have had the opportunity to participate in the first two sessions in this series. Today, we're going to be focusing on early educators' voices. I'm Ruth Schmidt. I am the Executive Director of Wisconsin Early Childhood Association. I want to share just a little bit about WECA. We are a statewide nonprofit organization, and we work with about 90% of both early childhood educators and child care programs in Wisconsin. And we do this through a variety of programs and services, including scholarships, stipends, food and nutrition, professional development and career counseling, pre-licensing, and a shared services network for early childhood programs. We are the state affiliate of the National Association for the Education of Young Children, or NAEYC. This past January, we launched the WECA Center for Policy, Research, and Engagement, which is home to much of the advocacy and policy work we do. I have been at WECA since 2002. In 2019, with funding from Pritzker Children's Initiative, WECA, along with over 35 organizations from across our state and municipal, county, and state level government, began focusing on policies and budget strategies to help move the needle on infant and toddler care and the health and well-being of infants and toddlers and their families. Our planning grant year included surveying parents and educators from across the state and hosting regional listening sessions and community conversations. Year one of our infant toddler work resulted in a complex plan with goals, strategies, and lots of actions to bring about bold change for infants and toddlers and their families. However, when reflecting on our plan, we also learned a critical lesson. When you're working in a state like Wisconsin, you end up with a narrative and with goals and priorities that are framed around the white experience. Our plan did not ensure that it was fully informed by the lived expertise of women in the early care and education workforce, and specifically Black and Brown educators. WICA commissioned the work of Dr. Toshiba Adams to deepen our understanding of and to ensure input from the early childhood educators who identify as Black, Indigenous, and persons of color. Her work included both a year of narrative inquiry centering the lived expertise of BIPOC early educators and the formation of the Advancing Equity in the Early Childhood Workforce Steering Committee. WICA was grateful to have been able to fund Dr. Adams' work with support from Pritzker Children's Initiative and the American Family Insurance Institute for Corporate and Social Impact. Shortly, you will have the amazing opportunity to hear from Dr. Adams and Lisa Garley, a member of the Advancing Equity Steering Committee. The story of Dr. Adams' narrative inquiry and the first few years of the Advancing Equity Steering Committee is compelling and has been critical to policy work in our state. They've shared their work broadly at conferences, on webinars, at community-based presentations, at board meetings, and in publications. As you listen, please keep in mind that WICA has received funding from the Robert Wood Johnson Foundation to create a one-time opportunity for a handful of states to receive technical assistance from Dr. Adams, along with Advancing Equity Steering Committee members, or from our partners, Kids Forward and All Children Thrive, who you have heard from in prior webinars on strategies for including the lived expertise of parents and caregivers in policy work. I am now excited to hand the presentation over to Dr. Adams and to Lisa. Thank you.
Thank you, Ruth, for that very warm introduction and for providing an overview of our collaboration together. Again, my name is Toshiba Adams. I currently serve as a college and university professor in Milwaukee, Wisconsin. I teach in the areas of child development and educational policy. I am also the founder of Sankofa Consulting and Training, which is a nonprofit organization that works to support the early education workforce through professional development opportunities and research. So at this time, I'm going to be providing you with the what of the research, what we did in the state of Wisconsin to help elevate the voices, lived expertise, and intellectual capital of Black and Brown early educators. So for today's presentation, Ruth has already provided you with an introduction to the collaborative work that we have embarked upon here in Wisconsin. I will provide you with an overview and the results of the qualitative research study that we implemented. My co-presenter and co-researcher, Lisa Garley, will introduce the Advancing Equity Steering Committee and talk a little bit about the activities and the policy recommendations that they have made over the last year in reflection or in response to the findings from the qualitative research study. And then we'll open it up just to kind of introduce to you some of the technical assistance opportunities that we can provide to you. Again, as Ruth has stated, is fully funded through the Robert Wood Johnson Foundation. It's a free service to you, or free service to you. And then hopefully we'll have time to address any questions that you may have. But as Erin stated, if questions come up, please put your information in the chat, and we're flexible enough to kind of stop and pause and try to address your questions along the way. So with that, next slide, please. Next. Okay, so the what? So what do we do in the state of Wisconsin to elevate voices of Black and Brown early educators? We designed a qualitative research study. And so I'll kind of go through the approach and the framework that I utilized and relied upon to ensure that we were implementing culturally responsive frameworks and instruments in this work. So first, I utilized a storytelling methodology. And so storytelling has been very prominent in the African community where my ancestors used stories to carry down information, culture, and things of that nature across generations. But as I completed and worked on this research, I also found that storytelling was very prominent in the Native American community, the Hmong community, as well as the Hispanic community. So storytelling as a method for collecting data and information was very fitting for the work that I was doing and for the population that I was serving. So that is the methodology I used. So myself, as well as the other field researchers, it allowed us to ask specific questions of early educators in Wisconsin, and then it allowed us to kind of sit back and allow them to tell their stories in the most authentic way, which represented them, their lived experiences, the children and the families they served, as well as the communities that they represent. In addition to a storytelling methodology, I adopted what is coined as a community-based participatory design. And so basically what that means is I did not want to go into this work and conduct research on top of people. I wanted to conduct research with and in collaboration with the early educators. So using this framework allowed me to not only conduct interviews to better understand their experiences, but then to invite them into a space with me so that collaboratively we can work alongside of each other to further dissect the research findings and determine what type of policy recommendations were most beneficial, again, to them, the children they serve, and the communities that they represent. So these are key or examples of what qualitative researchers would use to make sure that we're moving forward in this work in a culturally responsive way that respects the identity of the people that we are trying to collaborate with. In addition to that design approach, I made sure that I adopted theoretical postulations or frameworks that also made visible the lived experiences of communities of color. So I adopted what we consider a critical race theory framework, as well as intersectionality, and combined these two frameworks allowed me to scrutinize the policies and practices that are implemented within the early education structure and framework within the state of Wisconsin. And I did that intentionally to look for remnants or traces of racism, sexism, and genderism, because if we look at the turbulent history, we know that communities of color have been suffocated and smothered within systems in the United States of America, and then really globally, this has been taking place, right? That exclude them from gaining access to resources and opportunities. So this was an intentional framework, and it allowed me to kind of examine things or concepts through what Patricia Hill Collins referenced as trilogy of oppression, looking at how individuals are oppressed at the intersection of their multiple identities. So as far as a recruitment effort, we designed a marketing flyer, and this marketing flyer was disseminated broadly through social media, through professional listservs in Wisconsin, for example, DCF, through WICA, and also through MATC. And then we used the snowball method, which means that when we interviewed or entered into a discussion with a particular person, we asked if they could refer someone else for the study. So I did not collect this data alone. I did recruit the help and assistance of other field researchers. So you can see Tamara Johnson, Jima Castro, and Sandy Tao was also a part of the research team and helped me to gather that important data. I wanted to make sure that the research team represented the early education workforce in Wisconsin. And so that way people would feel more comfortable telling their stories and again, being really authentic in telling their stories in a way that they didn't feel scrutinized and was not intimidated. So I'm just going to pause here and kind of engage you all for a second. I hope if you look at myself and you look at the field researchers that we worked with, who is not represented in the field of early care and education as it relates to early educators? So I am a Black woman. Tamara identifies as a Black woman, Jima, Hispanic, and Sandy, Hmong.
And
Oh, Jeremy, I knew you would be here and I knew you would call me out on that. Yes, we did not include men of color. And that was not an intentional exclusion. So that was just an error or a mishap on my part. Sometimes when you're in the thick of the work, your brain does not focus or function the way that you want it to or the way it should. So that was not intentional. But yes, shame on me. I should have known better. So yes, you are correct, Jeremy, that we should have had a man of color on this team. And had we had a man of color on our research team, you'll see on the next slide, our respondent rate would probably have looked a bit different. But I'm still on the other slide. Sorry, I was just saying when I get to the next slide. Any other groups missed from our team? Anyone else have any other feedback on that? So I'll just continue to expose myself. Look, I'm an educator, so I'm very transparent in this space. I feel like the learning process involves us making mistakes and learning from those mistakes and also being transparent in our mistakes. So now you can learn from my mishaps, right? You don't have to make the same mistakes. You can learn from my mistakes. Trust me, when you embark upon this work, you're going to make enough mistakes on your own, and I'll be able to learn from you hopefully in a future webinar. We also did not have an individual to collect data from the Native American community, but that's not because I did not try. I have tried and I have made connections with individuals, but I have not been successful in working with that particular population. And it really makes sense to me. Again, if we look at the turbulent history of Native Americans, not just in Wisconsin, but across the United States of America, these issues of massive genocide, assimilation, they don't trust us as society members. So, and I understand that. And then they have this whole concept of sovereignty where they want to be in charge of their own systems and institutions. So I respect that. Hopefully one day someone will be interested in speaking to me, but I understand why they are reluctant to let someone other than their own community members into their spaces. Also, what I learned doing this research is initially what I did is I lumped Asian Americans all as one category. But again, we know that Asian populations are not a monolith. And so as I continue to do more research, what I learned is that the Hmong population as a subgroup of the Asian racial group are one of the most marginalized subgroups of that Asian racial categories that exist. They are marginalized by being excluded from high quality educational experiences, job opportunities. They have really high levels in response to that systemic inequality, high levels of suicide and depression and things of that nature. So understanding that, we knew that maybe it was more necessary to hear specifically from the Hmong early educators in Wisconsin, to hear their stories as a separate subgroup from the Asian American population. So we did embark upon that separate study to help elevate our knowledge base from that population. And so I do have the Hmong cultural caregiver and early educator research snapshot and the executive summary that should be made available to you in the chat, as well as the original executive study summary from the Advancing Equity work that was done in 2023. Did anybody else have any? Did anybody point me out?
Can I ask a couple of questions that have come in? So were there direct representation of classroom staff and parents?
Okay, so good question. So embedded, and I'll get to that in a couple slides, embedded within our participant response, there were directors, there were classroom teachers, there were floaters, there were trainers, there were childcare owners. And so I have a later slide where I'll break down the demographics of the individuals who participated in the study. As far as parents are concerned, I did not work specifically with the parent group because Aaron and Dahi did that work. So if you were part of their presentation a couple of weeks ago, you were able to better understand how they engage with the parents in the state of Wisconsin and the work that they are doing. If you were not able to, don't worry about it. I think you can still gain access to that webinar from the Build website, and maybe we'll kind of put it in the chat during this webinar as well.
That's perfect. And just know another person was talking about school nurses of color and their point of view. And so to maybe touch on that when you go into your slides. And for folks who are joining in the chat box, you will see the study overview and findings, the executive summary, and the research study snapshot. Just
Thank
let
you.
you know, those links are in there. Yep.
Okay, so with the four of us going out recruiting and collecting data, it allowed us to gain access to 45 individuals who are interested in this study. So the original was 45, but then when we added the separate study that was just finalized earlier this year for the Hmong population, then that was an additional 10, so total 55. So we did individual interviews with 45 participants, and then second round interviews with 20, and then we also established 2 focus groups. So the way that I analyzed this data, it was very time consuming. It was a lot of work, but I love doing the work. So I read all of the interviews multiple times, and I started to put codes within the margins of the interviews, just kind of like, okay, what are these individuals talking about? And so over time, I started to see these emergent themes, like what individuals are talking about, not only within their individual interviews, but what was coming up and emerging across interviews. So what were they all saying that was kind of like collective data? So that was how I analyzed it. And then I came up with the emergent themes, which I will further explain. And then I also did a process called member checking, where I, of course, I trusted myself to make sure that I was coming up with the right themes, but I wanted to make sure that I was representing their words, their stories, and their perspectives accurately. So then I sent the themes and the illustration of the themes to the research participants, and I just asked them to make sure that I got it right. And according to their feedback, I got it right. So that was our approach in the qualitative research design. Next slide. So participant data. So this kind of gives you an overview of the people who we spoke to. Racial background or racial identity, the majority of them were Black. And again, that might be because I'm a person, I'm a Black woman, and Tamara a Black woman. So we may have been able to recruit more Black people who felt like they trusted us enough to talk to us about their experiences. We had Hispanic population at 16%, Asian population at 18% again, but in this moment, I did not disaggregate within that Asian population. And then we only had 2% respondents that mirrored the Native American race. And again, probably because we did not have a Native American person on our research team. The majority of the respondents live and work in the city of Milwaukee. The gender, the majority of them were women at 40 and 5 males. So again, Jeremy pointed out, we did not have that male of color. Had we had someone like Jeremy or someone else working in the field of early care and education, helping us to recruit, I'm sure that number would have been elevated for the men, and we could have done a better job at elevating and understanding their voices. I am working on receiving some additional grant funding that would allow me to go back into the field to speak specifically to men of color. But in the interim, I did also submit an RFP to WICA, and I was funded through Wisconsin Early Child Association to support men of color in the field. And so for a year, I was able to pay their tuition at Milwaukee Area Technical College. We bought laptops, hotspots for these individuals. We paid for them to go to conferences. We paid for other items of professional development, provided them with stipends for their time. So I have been able to engage with some men of color, but I do want to extend that work and keep that going, because we know that they are an important part of our industry, and we do respect and love them. Career levels, again, we had a myriad of career levels. The majority of our respondents were family professionals, followed by group lead teachers, group assistants, down the gamut to group trainer. And these individuals, I have to pause and say, are highly educated people, ranging from a series of registry credentials all the way to one person holding a doctorate degree. So we have a lot of intellectual capital within our early education field in the state of Wisconsin, and I'm very proud of that. Next slide. Okay, so the research findings I'll kind of go through briefly before I pass it off to Lisa, because again, if you read the executive summary, you'll have more depth information about these themes. But based on all of the interviews and me analyzing all of that data, these are the most highlighted themes that came out of the research. And you'll see these themes in quotation marks because these are words that came directly from the interviews. These are not my words. So the first theme is living paycheck to paycheck. We all know what that's about, right? These individuals are complaining about living in poverty wages. high quality work, high quality people, not high quality pay. So in addition to earning poverty wages, they were complaining about all of the work that they have to do on a day-to-day basis. Their work does not just end at a 10-hour shift or a 40-hour week. They're taking work home, they're taking work and doing things over the weekend. And they talked about how taxing it was for them, to where they served other people's children all day, to the point to when they got home to their own family, they had nothing left. They were socially bankrupt, emotionally bankrupt, mentally bankrupt. So they just talked about how taxing it was for them. They also talked about the educational requirement, and none of them complained about going to school and maintaining their higher education credentials. But when they juxtaposed the expectations of the education based on their poverty wages, to them, it just did not make good sense. So that was that theme. DCF is a lot. So Department of Children and Families is a organization in the state of Wisconsin that regulates both family and group center childcare programs. And so they complained, many of them complained about the relationship, the social relationship they had with their licensor, who would come out to review their programs. They talked about how their relationship was very racialized. They felt like it was demeaning. They felt undervalued. They felt disrespected. And they felt like they were treated that way based on the fact that they were people of color working in areas that were highly populated by other people of color and serving Black and brown families. So they pointed it to elements of racism. Stuck at a 3-star. So in Wisconsin, Young Star is our quality rating system. And so a lot of them complained about the fact that even though the star rating system goes from 1 to 5 stars, they could never go beyond 5 stars. And they talked about it from the vantage point that they were not receiving enough income through Wisconsin Shares into their programs to be financially stable enough to make sure that they were able to comply. And so specifically, they complained about the learning environment criteria and the education requirements. They were not able to buy equipment in abundance and change their environments the way that this criteria was stating they should. And many of them were just talking about how they could not afford to go to school, or it just didn't really make sense for them to get a higher education when they were making poverty wages. Seat at the table. They talked about how policies in Wisconsin have historically been devised based on people who don't look like them, people who don't come into their communities, people who don't even talk to them to learn about their perspectives. And so they were saying, hey, just give us a seat at the table. Let us co-develop these policies with you. We know what we need. We know what our communities need. We know what our children and families need. Why don't you respect us enough to talk to us? Give us a seat at the table so we can help ensure that the policies are equitable. And then finally, mental health break. Again, these are their words. They were just talking about how living under this system in Wisconsin, being suppressed and oppressed under the system that was not, they don't perceive as equitable, it really was taxing on their mental and psychological well-being, which we know is not good, because if they're not psychologically and emotionally well, how are they then able to provide the accurate services to children and families? So that's kind of a summary. Again, you can read the executive summary to get more information. I see Erin just popped in. So is there a question for me?
Yeah, just a couple of things to get to these themes. You talked about focus groups and participants. How many did you have? How many participants did you have in your focus groups? And then how did you organize them? What did that look like?
Yeah, so the focus groups were anywhere between like 6 to 8 individuals. We didn't want it to be too much, but I knew that focus groups were important, because anytime you're engaging with people in this manner, they look at myself as the researcher, as the person with power, right? And so in order to minimize my power, in order to minimize the power of the field researchers, I knew it was important to put them, or the early educators, in a group to where they can more so control the flow. And that's kind of how it was. It was conversations between them, piggybacking back and forth. And so for the focus groups, I tried to make sure that I didn't try. I made sure that directors and owners were in a separate focus group from teachers and assistant teachers, because again, it's that power dynamic. I didn't want their supervisors or their overseers to be in the focus group with them and then minimize them in a way to where they wouldn't speak and be free with their sentiments. So that's how we did it. We did it based on their career level.
That's super helpful. Thanks for sharing that. And I think the other piece too, that is being brought up is around gender, and seeing if there were any non-binary participants, or if that should be included in the future.
Yeah, that's a really good question. So we did disseminate a demographic survey. I'm sorry, I failed to say that. So the demographic survey was a series of questions that asked them about their identity, who they are, their career levels. And I used the demographic survey to compile that, the participant profile. That's how I knew their profiles. So we asked like how they identify. They identify as male, as female, as non-binary? So we asked all of those culturally responsive questions, and that's how I came up with the demographic information. So thank you for bringing that up, and I apologize for failing to discuss that at the onset of the study.
Yeah, thank you. And then just a few comments that mental health is an issue in San Antonio, in New York. That's coming, we're hearing that all over, folks are saying. So wanted to let you know. All right, thank you.
Okay, so at this time, I'm going to pass the baton to my co-presenter and co-researcher, Lisa Garley. And I just want to pause and just say that I'm so excited to be in this space with Lisa. She has been working alongside me as a participant in the research and as a member of the Advancing Equity Steering Committee. Her intelligence, her commitment, her contributions have been invaluable. So again, I'm just honored to be here in this space with her. Lisa?
Oh, thank you, Dr. Adams, for those kind words. My name is Lisa Garley, and I am a part of the Advancing Equity Steering Committee. Just a little bit, I started out with being interviewed by Dr. Adams, and then I was asked if I wanted to be a part of the Advancing Equity Steering Committee. And of course, I said yes, because you have to have voices to stand up for the things that are going on within the early care field. And I feel like I am one of those people. So that's kind of how this all came about. So if you can go on to the next slide. So the role of the Advancing Equity Steering Committee is to dissect the research that was conducted by Dr. Adams, and then our role is to develop policy recommendations and to advocate for those policy recommendations with different state leaders and legislators. Our mission, and then I'm just going to pause for a second and let you guys know that this mission was created by our group as we were brainstorming the different, as we were dissecting the research and brainstorming on what is this group and what are we going to be. We came up with that we wanted to be that voice in the Black and Brown, and we wanted to be the voice for Black and Brown educators in the early childhood field, and to promote public policies that promote dignity and the well-being of early childhood educators in Wisconsin. So go on to the next slide, please. So who is in our committee? We have one male, we have 7 females, we have an array of careers within our committee. We have program directors, we have family child care professionals, we have a retired professional, we have a trainer, and then also we are evolving as a committee members, and our roles are changing as we continue to grow in this field. The racial identity that our community members identify with, we have 5 Black individuals, we have 2 Hispanics, and 1 Native American. We also have different ranges. Our range of education within our committee is a registry credential all the way up to a master's degree. And we have a wealth of knowledge that is within our committee. Our committee members have anywhere from 8 years of experience to 30 years within the early care field. If you can go on to the next slide, please. So our methods, how do we do the work that we are doing? So we meet once a month. Sometimes we meet on more than once a month just to do the work that we're doing. It just depends on what we're working on. But we typically meet for about an hour and a half. These groups offer support for us to have some hard conversations at times, and also the opportunity to be able to dissect the research and talk about what are these policy recommendations we want to make and what that looks like. We also, in these groups, we build our advocacy and leadership skills because we have to support each other. And one of the things that came from our group was we need to dig into advocacy and understand the why behind it and what we can do to support the Black and Brown communities. We have done presentations. We have done presentations within the state of Wisconsin. We have done presentations outside of the state of Wisconsin. We are continuing to grow. And as Dr. Adams said, like, this is where we're at now, but we're going to continue to keep moving as a group. This is one of our pieces, just being here today. Is one of the ways that we're building more awareness and trying to support others within the Wisconsin community, but also just nationwide. So we also, some of the work that we're doing is policy recommendations. We have talked with the Department of Children and Families. We've talked about ratios, diversity in staff, culturally responsive trainings, and so forth. We've also worked with WECA, Wisconsin Early Childhood Association, in regards to diversity in staff, expanding understanding for the TEACH scholarship program. And then also, we do a lot of follow-up too. So once we have these conversations in regards to policy recommendations, we always try to go back and have conversations on where is this policy, where are the policy recommendations at? What is that looking like, to answer any further questions, or just to be that voice and give them any information that they're looking for as well. We actually have a meeting, I want to say August 25th with Ruth, the WECA executive director. We also, in these groups, we're building our advocacy. We went to workshop trainings. We've had different guest speakers within our group meetings. We have went to JFC hearings. We went to WECA's Advocacy Day, where we were able to talk to legislators and be able to explain our perspective in the early care field. We also are compensated for our time, and very grateful to WECA for being able to compensate us with gift cards monthly for the meetings that we attend, or if we go to any additional meetings. If we go to national conferences, WECA provides us with the lodging, pays for us to attend the conferences, and then pays for other expenses that come along with going to conferences. And then also our meetings, we also make sure that others that speak different languages are able to have their needs met. And so we have a Spanish translator that helps us during our meetings and also at our presentations as well. If you can go on to the next slide, please. So these are a few pictures of some of the things that I talked about in the previous slide. So for our professional development, we had Paula Drew come in and talked about legislators. What does it mean to have a bill passed? How does that process go? We've had advocacy meetings. Tanya Wooding came in and she talked about how we can be that voice and what that voice looks like, and how to even write our speech, our hallway, our elevator speech, when we are meeting with legislators. We've had leadership meetings as well. You can go on to the next slide, please. We went to multiple national conferences. We went to the NAEYC Policy Forum and presented. We also went to the NAEYC PLI in New Orleans, and we presented there as well. You can go on to the next slide. We also were able to talk with Daria Hall. She works for the Department of Children and Families. We were able to have conversations in regards to YoungStar, which is our starring system. We were able to have conversations of where the research that Dr. Adams conducted, were some policy recommendation changes that we would like to see happen, and just have a brainstorming session with them as well. We also were able to present to the WICA board about the work that the steering committee is doing, and just giving updates of where we were at with policy recommendations, and then just to be able to get feedback from them as well. You can go on to the next slide, please. So thinking about that seat at the table, this is really powerful as well. We have two of our members of our Advancing Equity Steering Committee were able to join the WICA's board, which is really amazing for them both to be able to do. And then also just empowering them to be a voice in different groups that maybe they didn't have the opportunity to be a part of before. Even another piece, I know I said before, we presented at the WICA's board, but that's also having a seat at the table, being able to sit there and be able to tell our perspective of what we're seeing, and being able to be that voice. You can go on to the next slide, please. We're always out in the community as well. If there's any events that we're able to attend, a lot of people do reach out to us, and they do, as a Advancing Equity Steering Committee, they want us to come to these events. BCDI Gala, we've been there in 2024 as well as 2025. And as you can see, our group is continuing to grow. We're also able to network with others. In the 2025, we were able to connect with some employees at WICA, and be able to have conversations with them as well. Next slide, please. As far as advocacy and leadership, if you look at these pictures, we have some, Anita, she was able to connect with Governor Evers and have some conversations with him. Some other members were able to listen in on some, listen in with others talking about education in general, as well as early care. And then we were able to get the mic, and we were able to talk about some things that related around the policy recommendations that we had suggested. We have had meetings with legislators. We went to the WICA advocacy. I was able to speak on the advocacy day to share my journey within early care, but then also to talk about the inequities that can't come along with that. We were able to, Bianca's in the background at JCF, she was able to voice some of the concerns that we had as a Advancing Equity Steering Committee. And then we had a day without childcare as well. You can go on to the next slide, please. So this is just a few more pictures. I'm a visual person, and I think it's nice to have pictures just to see these and how we came together as a group. And it's not just one, it's all of us. We have to be in this together, and we have to support each other in different ways. Where one person is great at speaking out in large groups, our committee, somebody else may be not as comfortable, but they're good with the logistics piece. So you just have to build off of each other. We continue to connect with state organizations. We continue to progress this group and continue to grow as an Advancing Equity Steering Committee. And that's what we do in a nutshell, in a little bit of time that we have here. So now Dr. Adams is going to take us on to hear a little bit more about the why behind this.
Okay, thank you so much, Lisa, for providing us with that overview and recap of what we all have been up to for the last 12 to 18 months. Again, I appreciate your passion and commitment, and I just genuinely love and respect who you are and the work that you're helping us to lead in the state of Wisconsin. So, okay, so the why. So I talked about what we did. Lisa has already kind of spoke a little bit about the role of the Advancing Equity Steering Committee. So I'm going to speak briefly about the why. Why did we do this in the state of Wisconsin? So next slide, please. So why did we think it was important to elevate the voices, concerns, intellectual capital of Black and Brown early educators in Wisconsin? I think Ruth Schmidt kind of hit on it a little bit. But I think it's also just important to kind of put it in perspective. So those of us who are familiar with the field of early care and education, we know that it is a suppressive field for everybody, regardless of your racial or gender status. People are marginalized by low wages, little to no benefits, laborious workloads. But if we introduce and we look at those perspectives through a theory that's called intersectionality. So Kimberly Crenshaw brought up this theory and coined it intersectionality. And basically what it says is that based on an individual's social identities, they are marginalized in multiple ways. And those marginalizations come together and compound their experiences in a more negative way. So they intersect. So for example, I am a Black woman. I identify as a Black woman. So I have received discrimination or experienced discrimination based on the fact that I am Black and based on the fact that I am woman. And unfortunately, I will continue to experience discrimination across my lifetime. That's just the society that we live in. But those are examples of how my identities intersect to exasperate notions of inequality. So if we apply this theory of intersection to the field of early care and education, then it allows us to better understand how Black and Brown individuals are more so marginalized within this field, and more specifically, Black and Brown women. We find that Black and Brown women are marginalized as infant and toddler room teachers in a disproportionate way, where they suffer a wage penalty. And the research also reminds us about how even though many Black and Brown women have acquired educational levels that are equal to or higher than their white counterparts, their income, their wages are still suffocated under their white counterparts. So these are some reasons for us to go into or embark upon a research to better understand the experiences of that specific group, not to negate the experiences of others, but to highlight this specific group because, again, they have been historically smothered. Their voices have been historically smothered. No one has really cared about listening to their experiences, but they're smart. You heard Lisa. You hear me. We're smart. We're intelligent. We have a wealth of knowledge. And these are the population of people who can provide feedback that would allow policymakers to design policies, programs, and practices that are equitable for the entire field of early education. So we need to respect people, we need to respect their standpoint, and we need to understand their struggles in order to do better as a society. So that's why we embarked upon this study to highlight the specific experiences of Black and Brown early educators in Wisconsin. And I'm so proud of the work that we have done. So proud of the connections I have made with these early educators. Some of them were my former students. Today, I call them my friends. And so we've made this journey together, and I'm so proud to be in this space with them. Next slide, please. So the outcomes thus far, next slide. Lisa has talked about some of those outcomes, but specifically to WECA, she talked about the steering committee members. Also within WECA's system, their pre-licensors are very diverse, and those are the people who work with early educators before they go into the licensing system. Composed of Black, Hispanic, and Hmong individuals. The information is translated in multiple languages so that everyone has an opportunity to be successful. We talked about from the research findings that some people weren't familiar with the Teach Scholarship Program, but they knew that they needed access to that funding in order to do better as far as matriculating it at the university and college level. Over the summer, I know that Jeanette Paulson has started hosting information sessions to college and university leaders, and I know that because I was a part of one of those sessions, informing us about the Teach Scholarship Program in a way that will allow us to kind of help to spread the word. And the leadership team at WECA ongoingly, on a regular basis, they try to engage the committee. They don't try, they engage the research committee. They invite them to advocacy activities. They pay for these stipends. And so they have been very supportive. In the areas of DCF, the licensors are now required to have a background in early childhood education, whereas before some of the licensors had backgrounds in like criminal justice or were former police officers, and people complained about that highly. So now that's a new policy. Whenever they have positions available for their licensors, they share that with me, encourage me to encourage the Advancing Equity Steering Committees to apply or to share the posting information within their communities so that they can better diversify that pool of candidates. They have been on attending sessions with us and listening to the concerns, inviting us to sessions. and listening to the concerns specifically centered around race and poverty. And again, just inviting us to talk to them more specifically about Youngstar and DCF licensing. So as Lisa indicated, we're not done. The relationship is not over. We do have some follow-up meetings with them. And so we'll be able to report on that soon. Next slide. So finally, I just really excited about this partnership that I was able to forge with National Association of Education of Young Children. The leadership team at NACCE have also been very interested in the work that we are doing in Wisconsin, and they want to continue to elevate this work, elevate the voices of Black and Brown early educators in Wisconsin. And so our partnership is providing us with a very significant platform. So myself and the steering committee members, we've already started our journal manuscript. So they're allowing us to co-publish, inviting us to co-publish 2 journal submissions in their NACCE Young Children Journal. They have given us a platform to where we can write blogs, co-write blogs to talk about our experiences and the work that we're doing in Wisconsin and the policy recommendations and just kind of tracking that process. We tentatively have a live webinar scheduled for October 2025, and Lisa and I both plan to attend the NACCE conference in November, again, to kind of continue to spread the word about what we're doing in Wisconsin and elevating the experiences of Black and Brown early educators, because we know how important that work is. Next slide, please. So if any of you are interested in embarking upon a qualitative research design or forming a steering committee of early educators in your individual states, we are here to support you. Again, as Ruth indicated, the work that we're doing as far as the dissemination part is fully funded by Robert Wood Johnson Foundation. So we can just help you, and it's no charge to you. We can customize the way that we support you, or you can tell us what you need, and we can meet you where you are. So I know that we're running out of time, so that's why I'm just kind of going through this a little bit more swiftly. But on the next slide, I think our contact information will be made available. You can contact me here. I have produced a series of publications in regards to the work that we have been doing over the last year or so. Those publications have been dropped into your chat forum, but you can also go ahead and scan that QR code. It'll take you directly to my website, and all of these publications are housed there as well for your edification. Hopefully you'll gain access to them. Hopefully we have encouraged you to do some of this work in your individual states. And yeah, so again, I'm so happy to be here with you all today. Thank you for taking time out of your busy schedules to engage with us. And at this time, I think I'm going to turn it back over to Erin.
Thank you so much, Lisa and Toshiba. There is one comment and question that I would love to ask you as we're wrapping things up here. The comment in question is as follows here. Based on the extensive research base we have on the importance of high quality early care and education, have you reached the conclusion that policy functions purposely to keep people in their place? I know that people often want to say that our lawmakers are incompetent when it comes to early childhood education, but I think they know exactly what they are doing. I don't think they want our young children to grow up and gain social mobility. I'd be curious to hear your thoughts.
Yeah, that's a really deep and engaging question. So in addition to my identity as a Black woman, I do consider myself to be a feminist scholar. So I agree with everything you just said. I agree that historically systems have been designed and perpetrated to maintain the status quo, right? So to privilege whiteness while at the same time denouncing anything that is not of whiteness. So it's a concept that we in the scholarship call other. So they're othering us through these policies and procedures. Yes, I think it's intentional. Yes, I think it's to maintain privilege. I mean, the higher our levels of education, then we become intimidating to the status quo, right? So yes, I do think that a lot of policies and laws are maintained and developed to keep people in their place. And so then we just, we maintain the status quo. But that's why I do this type of research, because I want to call out systems of inequality. I'm not afraid to do that type of work. I think it's necessary. It's part of my DNA. This is who I've been since I was a very young child. Like, that's not fair. Mom, this happened to me at school. This isn't fair. So who you see me as today is just who I have always been. And this is the type of person I'm going to be as long as I'm in this field. And supporting Black and Brown individuals is what I do, because, and I'm not here to be their voice, because that's disrespectful. They have their own voice. I'm just here to help orchestrate the elevation of their voice and their concerns to a population of individuals who can actually do something about it.
Wonderful. Thank you so much, Lisa. Is there anything else you wanted to share?
Yeah, I would like to say, take advantage of this opportunity because as we know in this field of early care, funding changes every time. And it's wonderful that this money has become available and that you will have somebody that's been doing the work, especially Dr. Adams. She's very passionate about the work that she does in regards to the research. And when she actually sees, like example, in the beginning, she's told on herself, as I call it, we should have had more males present when we were first going about with this research, but take advantage because we're a wealth of knowledge. Like we've been through some of these pieces and we're still growing, so we're not perfect, not by any means, but we've been through some of the things that other people within Wisconsin or nationwide. I've seen Texas, New York, and all those other states, and it's good to have somebody to be able to brainstorm with.
Erin, can I just jump in
course.
and just say that Wisconsin had some very significant wins in our budget session that just literally ended at the beginning of July. And it included the first ever investment of state general purpose revenue into childcare, along with some other significant mechanisms for direct payments to early childhood programs. And it was the participation of educators from across the state, including every single one of the folks that serve on the Advancing Equity Steering Committee, that we had these wins. We've been working on this for a long time. And when we all come together and carry the same message with an understanding of how it benefits educators and children in their care, we can get things done. It was a pleasure working, Toshiba, with you and but the steering committee over the past year on advocacy efforts.
Thank you. Likewise.
Okay. Just want to say a huge shout out. Thank you. I know we have a few wrap up items here, but just want to again share appreciation, and the appreciation's coming in through the love and in the chats and whatnot. So thanks a lot. Here is some contact information. I do want to just mention and give a thank you to Build for hosting a webinar series. Thank you so much. This is number 3 of a 4-part webinar series. And so I want to encourage you to register for the 4th webinar here, focusing on advocacy. So what are the tools needed to drive equitable policy and systems change? And so folks will be back. We'll be talking about advocacy efforts next week, same time, same day, Thursday at 2 p.m. Central. I also just want to mention as well, along with this, is to just remind folks that there is going to be a feedback survey. Please complete that feedback survey that is for this webinar. And then last but not least, I do want to just remind folks about the upcoming Build Conference. We know that many of you are going to be there. Some of us who have shared today will be there. That early bird deadline is coming up, but want to continue the conversation. Again, that technical assistance is available to you. Please get in touch. Also, during the conference, folks will be there. And so it's just a huge opportunity to connect and to learn from one another. So once again, I want to thank you for joining. It's been a pleasure continuing to learn from Lisa and Toshiba. So thank you so much, everybody. Appreciate your time and thanks for joining. Have a great day.